For pregnant people with gestational diabetes, sometimes they'll need to use insulin. This is how you do it. First, you will wash or sanitize your hands and then gather supplies. You'll need the proper insulin, a needle tip, an alcohol swab if you wish, and a sharps container. We'll be using the rapid insulin for this demonstration. First step is to check and make sure that you have enough insulin in the cartridge, and you can see that by seeing that the rubber stopper is way down here. It gets pushed up to the end. If you see it at the end, you'll need to replace your cartridge. Now you take your fresh needle head and you remove the paper backing and put it directly onto the tip and twist. Then you remove the first cap and the second cap, and now your needle tip is exposed. To prime or to check the flow of the needle tip to make sure it's not bent anywhere on the inside, you dial it up to 2 units and press. And I was able to see the insulin shoot out across the way. Now you know that the insulin is primed in the needle. You can dial it up to your recommended dose. Once you've dialed it up, you will then turn it to a 90-degree angle into your skin, and it can be either your belly, your buttocks, your thigh, or your outer arm. Press the plunger down until you hear the click and it goes to 0. Then you count to 10 and then remove. Now to get this needle tip off, you don't want to put your fingers near it because you'll get poked. You take the bigger of the 2 caps that we took off earlier, recap it with the bigger one, and then twist to remove. Now you can safely put it in the sharps container. In the hospital, you may get safety needles, so you don't have to worry about that part, but out in the community, that's what's available. Now some tips. You want to remove the needle head to avoid introducing air or causing leakage. Sometimes the leakage can throw off the concentration if it's a mixed insulin. You need to rotate injection sites because if not, you can cause scar tissue and lumps and the insulin doesn't get absorbed properly. Always use your sharps container. When you're out, you should be carrying your meter, fast-acting sugar, and identification to show that you're on insulin just in case you have a low and you can't manage it yourself. Always check your sugar before driving. As for the insulin itself, keep it in the fridge until opened and discard after 30 days, or if it was frozen or heated or expired.